September is Pain Awareness Month, but for those living with chronic pain, no reminder is needed. But you may be unaware about some of the latest technology to help with your chronic pain. And here to shed some light on some breakthrough tips and technology is Dr. Natalie Strand. Good morning.
Good morning. Thank you for having me.
Glad to have you on. You know, we're talking about managing chronic pain this morning. And for those living with this on a daily basis or on a weekly basis, this is absolutely life-altering. You know, what do you have to share with our viewers this morning to hopefully maybe provide some hope, some much-needed hope for them?
Well, I really want to share that everybody responds differently to chronic pain treatment, so it's important to tailor the approach to every specific patient. And often we need a multimodal therapy, meaning a combination of medications, lifestyle changes, and opiate-free technologies like the Quell device.
Well, and we are going to be talking about some of the new technology and some new options for people to consider this morning. Is it an exciting time to be dealing with medicine? And again, are there new options? And is new technology providing more hope for people? I hope so.
Well, you're absolutely right. It's a very exciting time for pain management, both for patients and for providers, because we finally are starting to have more things to offer in addition to the traditional injection therapies and medication therapies. So when we get a new technology to offer, I think it's very exciting as a provider, but it's also exciting for patients who are looking for therapies that have minimal side effects and that they can sort of be empowered to take control of their own pain.
Well, what is the most common cause, do you think, of chronic pain?
Well, there are a lot of causes of chronic pain. Some of the common ones are osteoarthritis, fibromyalgia, sciatica, painful diabetic neuropathy, but there are several different causes of chronic pain. But if you have recurring or pain that is constant for 3 months or more, you meet the definition of having chronic pain.
Well, when we talk about the importance of staying active and getting a good night's rest and eating, a great diet, but sometimes it can be kind of a catch-22, right? If you're not feeling well, it's kind of hard to stay active or it's hard to get a good night's sleep. What do you recommend for those people who are really struggling on a daily basis?
Well, as far as activity goes, you're absolutely right, but try to do mild to moderate activity. You might not be able to do the intense stuff, but moving a little bit is still going to help your pain. As far as sleep, practicing good sleep hygiene is very important, and also being empowered to know what else you can do. So in addition to sleep and exercise, stay educated and empowered. Go to quellrelief.com. There's some great information there on these new opioid-free technologies that can also help with sleep, but just the message is don't give up. Keep trying new therapies, keep trying new exercises, and just don't sit around and think that your life is over. Stay empowered and stay motivated.
Well, and I love that you say that. You say there is hope. You do not have to live like this.
You don't have to live like this. There is hope. Just don't give up.
Yeah. Well, I know you just mentioned that website. Any other website we should check out, or should we be heading to for more information this morning?
Well, I think for opiate-free technologies, that's definitely the one to head to. And, of course, educate yourself on the nutrition, on sleep hygiene. So I think that the more education that every patient can have, the better off they're going to be.
Yeah, and obviously talk with your doctor as much as possible, too.
Yes.
Thank you so much for taking some time to chat with us this morning, Doctor. We appreciate it.
Oh, it's my pleasure, Carly. Thank you.
We, of course, will put more info on our website as well, fox4morningblend.com.